my responsibility is introducing the session. So ocular trauma in India has various dimensions. So what are the common issues in India? Etiology and severity varies, and it might not be easy to manage with limited resources in secondary level, primary, secondary level. And there is lack of availability of proper facility, including the pediatric anesthesia, because children are most prone to have trauma. And sometimes infection often complicates the case. So managing that is also a big issue. And many times in our country, people present with trauma very late. So that becomes a big issue. I am going to share some little experience about that. And trauma needs proper counseling, and often the people who are dealing with it, they are not trained enough to counsel the patients properly. And what follows that, if the counseling and medical legal record keeping is not properly done, medical legal issues crop up, and I have suffered in my life. So trauma is really a very serious issue, and my following speakers will discuss it in different way. And I'm just showing two examples. This one I reported in Community Eye Health Journal in 2000, and rice grain was found growing inside the eye of this child. So this child came with only watering from the eye. We opened the eye, could not find anything, gave antibiotic, and after a few days the child came back with the swollen eye. Then we everted the lid and found that rice grain was growing inside the eye. So this one was first reported in Journal of Community Eye Health in 2000. Subsequently, I have experienced two more cases. So 3 cases I have experienced. And this is another case. It's a different case. You can see a tumor removed with smooth capsule from the anterior orbit. And if I show you, so this tumor was removed by me, and I thought it was a case of dermoid, but out of interest, when I wanted to see what is there inside, I was expecting teeth or hair. One piece of bamboo came out, and the mother couldn't remember when actually it happened, and it was more than 10 years old. Some piece of bamboo went inside the orbit, and it developed a tumor like this, and it remained like that for 10 years. So this is the typical scenario in India. People present very late. Thank you very much.
Grain is inside the eye?
Yes, please. Rice grain growing inside the eye. I have seen thrice. Growing, shooting. The plant is coming out of the seed.
How is possible?
Actually, the rice grain goes inside the eye, lodges in the upper fornix. Not much of irritation, and they get enough nutrition to shoot.
Oh, it had not pierced the eyeball.
No. It stays in the upper fornix. Yes, exactly. It grows there.
Exactly.
I have 3 cases experience.
Yeah. It's a most of cases, I know, but it's a delayed and neglected case you will see.
Yes.